Hi everybody, my name is Ellie Eye Girl. I am an eyeball person, a COA or a certified ophthalmic assistant, if you will. I am certified through JCAHPO, which is the Joint Commission on Allied Health Personnel in the ophthalmologic world. They are a nonprofit organization that provides certification and ongoing education opportunities to allied ophthalmic personnel. They really set the bar and the standard as to what we should know and what we should be capable of doing while working in the field. I wanted to create this channel in order to bring awareness to people about their eyes and about eye health in general. I know a lot of people don't talk about their eyes and they don't really think that their eyes need any maintenance or any real concern other than, being able to see, but that's really not the case. The eyes are very, very important. Sight is one of the top 5 senses that we have. We have sight, smelling, hearing, touching, and tasting. And those are really important to our quality of life as human beings. Everybody has them or has had them at some point. So the basics I want to talk to you about today, they're nothing in depth. It's not going to be anything super exciting. The main thing I want to focus on is introducing you to the eye. And a lot of people already know about the basic structures of the eye, but I really want to hit on the basic anatomy of the eye so that everyone has a clear understanding of what I'm talking about moving forward. So I'm going to talk about the anatomy of the eye and some basic terminology that I'm going to be using in future videos. So the first thing I want to talk about when we're looking at the anatomy of the eye, and I'll put a little picture up here so that we can have something to focus on while doing this other than my face. The first thing I want to focus on is the cornea. The cornea is the front structure of the eye. It is the first place that light comes in to the eye. It is responsible for 2/3 of the refracting power of your eye. So most of your sight comes from the very, very front of your eye, or the allowable sight, I should say. Most refractive problems, most problems that people have with their vision that can be corrected with glasses or contacts comes from the front of the eye. This is very, very important. So if that cornea is not perfectly rounded or perfectly shaped, that's where you run into problems with your vision. You have blurry vision up close or far away, depending on both the shape of the cornea and the shape of the eye. So that's very, very important to talk about. And we'll get into further detail about corneas in another video. Directly behind the cornea that you can see is the iris and the pupil. The pupil itself is not an anatomical structure, it's just a blank, empty space that allows light to enter the eye. The iris is a muscle, basically. And what it does is it moves either in or out to make the pupil larger or smaller in order to accommodate for the amount of light that's getting into the eye so that you're able to see well. Your eye color is based off of the amount of pigment and melanin that is located in the iris. So people who have lighter eye colors like blues and greens have less melanin, and people who have darker eye colors like browns have more melanin. Fun fact! I like the way my hair fell right like that. Melanin is created by our bodies to help protect us from UV damage, damage from the sun. And the more you have, the more protected you are. So that's why when you think about the Earth and you think about the equator, people who come ancestrally from places that are closer to that equator line are going to have more melanin. And that's because they need more protection against the sun's harmful UV rays. People that are further away from that equator have less melanin, so they don't need quite as much protection because they're not getting as much UV damage. In between the cornea and the iris, you have what we call the anterior chamber. So there is space in between your cornea and your iris, and that space there is called the anterior chamber. Not a whole lot goes on there, but we will talk about that in another video because the anterior chamber is quite important. Directly behind the iris, we have the lens. The lens of the eye does that final 1/3 refracting power to allow light into the eye and to get it towards the back of your eye onto your retina and your macula so that you're able to see. The lens is generally clear unless you're getting up there in age and starting to develop cataracts. Cataracts are something that, again, we will talk about in another video because they're a little more in depth when it comes to the lens. I like to think of the lens as silly putty. The lens is not how we think of lenses generally. It is moving and changing shape to allow that light to get to the back of the eye as efficiently as possible so that you have nice clear vision. Most vision problems are not caused by the lens unless you have cataracts. After the age of about 40 is when we start to see that the lens is starting to lose its ability to accommodate to the amount of light that's coming into the eye. So instead of being stretchy and bendy like silly putty, it starts to almost harden up and it's no longer able to refract the light in the way that we want it to. This is a process that we call presbyopia. It's the point in your life where you start to need reading glasses or bifocals. Most people, or I should say almost all people on the planet will go through this at some point. Some people are lucky and they start to develop this much later in life, and some people don't quite notice it happening at first because they're already nearsighted. Most nearsighted people are going to have a less hard of a time when it comes to presbyopia because of this. Directly behind the lens, then, we have the vitreous body. The vitreous body is about 70 to 80% of the rest of your eye, and that's what gives your eye that kind of sponginess. The eye is not filled with blood. Even though there is blood that goes to the eye and supplies the tissue with oxygen, it is not filled with blood. The filling of the eye is actually what we call vitreous, and it's this jelly-like substance that allows light to move through it properly. There's a lot to the vitreous body, but that's another video. And then finally, at the back of the eye, we have the retina and the macula and the optic nerve. Light is entering your eye through the cornea. It goes through the iris, it goes through the lens, and then through the vitreous body, and then finally it gets to the retina. The retina is incredibly delicate, and there's a lot of parts to the retina and the macula. But basically, it's a lot of nerves that they take the light, they interpret it in a way, and then they send it to your brain via the optic nerve. And that's what allows for sight. There's a lot that goes into eyes, and there are so many other tiny little structures in there that we could talk about, but that's a little more advanced, and I don't want to overwhelm anybody today. The last thing I want to talk about are some general terms about some of the equipment that we use, about some of the different processes that you'll hear me talk about. Probably the biggest one being a slit lamp. A slit lamp is a piece of equipment that we use that's basically a giant microscope for us. There's a chin rest and a forehead strap for people that we put the patient's head against, or the patient comes into against. There's nothing holding them there. It's just to help keep them steady while we're trying to look at their eye while it's magnified. So the slit lamps that we use at my work, they're these upright structures. They have all kinds of different lights. There's all kinds of different turning knobs. It takes a lot of finesse to be able to get the focus through the little eyepieces that we're looking at, almost exactly like you would do with a microscope. You have to get everything into focus before you're able to do an examination of what you're looking at. When we're using the slit lamp, generally we're looking at the outer structures of the eye. We're talking the eyelids, the cornea, the sclera, the conjunctiva, the iris, the lens, things like that. Generally the lens is not easily seen on the slit lamp unless the patient has been dilated. That'll be the next term we talk about. There is some limited view of the back of the eye if the patient has been dilated, but it's not quite as efficient. Most of the doctors that I work with tend to prefer to do their retinal examinations using a little headlamp and a large lens, turning the lights down and just shining that lens into your eye. It's not pleasant, but it gives a much clearer view of the retina and the macula and the structures in the back of the eye there that are generally hidden from view. So the last thing I want to talk about here today is the process of dilation. I hope most people that are watching this have already been dilated. Dilation is the process of instilling a drop into the eye. It's a medicated eye drop that pulls the iris out of the way, opens that pupil up real big, and then freezes it there. And this is really crucial to what we do in the eye world. There are new emerging technologies that allow us to do certain things without dilation that we've never been able to do before. But in the general sense, not every eye doctor is going to have that. So your best bet is to get the dilation done. It allows us to take a look at the back of the eye without all those other middle structures in the way. I have to pick and choose what I want to do here. Dilation can last quite some time. If you've ever been dilated, you know the pain. It's not painful, but it is annoying. And nobody in the eye world will dispute that. It's not fun. Generally is, you know, kind of discombobulating to your entire life. Generally, when you're dilated, people tend to have a harder time with their near vision. That tends to be much greater affected than your distance vision. So a lot of people, when they are dilated, they are able to drive. I know personally, my near vision is greatly affected, but because I am already nearsighted, I can just take my glasses off and the shape of my cornea allows me to still see up close. Your distance vision can be affected. I know mine is a tiny bit. When I'm dilated, my distance vision tends to be a little tunnely and maybe a little watery, almost as if you're like crying or your eyes are really wet. And it can be annoying. I wouldn't want to drive across town like that, but just to get home, I can do that. That's how it is from a lot of other people that I've talked to about the subject as well. But it's one of those things, if you know you're going to get dilated and you're not comfortable with it, bring a driver, bring someone with you. The only time I've ever seen eye doctors or companies like this turn away family members that are with you is during crises like this. So on a general basis, if you're not sure if you're allowed to bring someone, you can always just call ahead and ask. We'll never turn away questions like that. We want patients to feel as safe and secure as possible while also having their full in-depth eye exams. And dilation is incredibly important when you're having your eyes examined. There's a lot that can go on in the back of the eye without you knowing about it. And it's something that if we're able to catch things early, then the earlier we can start treatment, the better. And that's how it is in almost any health field. So most eye doctors recommend getting a dilation every 1 to 2 years, depending on the patient, depending on ongoing health problems. Diabetic patients are recommended to have a yearly eye exam. That's because diabetes can greatly affect the back of the eye. And if that's not caught in time, then it can have irreversible damage done. And that's something that anybody in the eye world would hate to see. Something that is clearly preventable happen to your vision. That's what we're there for. We're there to help people see better. So I hope you were able to learn something from this. I know it wasn't the most exciting video. I do promise that the eye world is quite exciting and quite interesting when you break things down. But when we're just talking about the basics, most people already know, but I wanted to get everybody on the same page so that moving forward, everyone will have a clear idea and a clear understanding of what I'm talking about. That's all for today, and I'll see you next video. Bye, guys.